Good afternoon, everyone, and thank you for joining us for another Facebook Live event. I'm Tara Lynn Wagner, and I am in the Basking Ridge office of Reproductive Medicine Associates of New Jersey today. And we have something a little new and exciting today. Rather than one, we have two members of the RMANJ family here with us. We have Dr. Jamie Morris and also Annika Levitt of FertiliTalk. So thank you both for spending some time with us today.
Well, thanks for having us.
Happy to be here.
So I'm very excited about this conversation. We have a lot to talk about. We're going to be focusing really on wellness and the types of support and services that are available to people who are going through fertility treatment. But before we get to that, of course, I have this small legal disclaimer that I need to read, so bear with me. The information provided on this Facebook Live video, RMANJ.com, and any other Reproductive Medicine Associates of New Jersey owned material is provided as an information resource only. It is not to be used for any diagnostic or treatment purpose. Nor does the information provided create any patient-physician relationship. RMANJ expressly disclaims responsibility for any damages, loss, injury, or liability whatsoever suffered as a result of your reliance on the information provided. Okay, so that is out of the way, and of course, before we get started, I always want to remind you that we very much want you to be a part of this conversation. So please send us your questions and comments. I will address those to Dr. Morris and Annika as they come in. So let me start with you first, Dr. Morris. I think when people think about reproductive medicine, they think about medicine. They think about the medical part of it. So the injections or the testing and the screening that's done. Tell me a little bit about the role that collaborative wellness plays in this picture. I mean, what does that even mean?
Well, collaborative wellness is just the idea of a whole big picture of taking care of a person, the patient, themselves, trying to actually make it sort of I guess the best way to look at it is kind of a whole scenario of what we can do to help someone. So it isn't just the tests, and it isn't just the treatments, or it isn't just the medications that you're taking, but also being able to help them spiritually, mind, body, the whole scenario to actually get us to those.
Obviously a very stressful time in a fertility patient's life. There's emotional stress, there's physical stress, and so this collaborative wellness approach really addresses all of that.
Absolutely, and stress is a big deal, and everybody going through fertility treatments, just even getting to walk through the door for an evaluation is stressful, for some more than others, but everybody experiences that stress. No one expects to actually be at that point where they're sitting across the desk from someone like me. So there is a huge amount of stress involved, and when we can do to try to reduce that stress with all sorts of alternative issues and be able to still focus on the medical aspects of helping someone achieve a pregnancy and growing their family, that's really what collaborative wellness helps us with.
So we're going to talk a little bit about some of the services that are offered here at RMANJ. But before we do, I want to mention you, Annika, because you understand that stress as well as anyone would.
Sure, firsthand. Right, so having gone through my own journey, I do understand the stress. And the most unique part about FertiliTalk, which is our Facebook support, is it's an entire network for patients by patients. So it's those of us who have been there, and there may be different in every situation, but people who really, truly do understand.
Did you come up with this in collaboration with RMANJ? I mean, you were a patient here.
Correct. I was a patient, and
you have two kids.
I do. I have two miracles. And I was invited to a patient research luncheon, and we shared ideas and our thoughts, and I was sitting there saying, I'm so blessed. I'm someone who has so many friends and some, terrific family. But when you're going through the journey, you want a safe place. You want somewhere where people understand, because you hear a lot of cliches and relax and, just don't think about things. So the idea came up for a safe place. And Facebook is so popular now. And with social media, I met with RMA, and I walked in knowing a lot about first grade curriculum, because that's where my heart is, and then I walked out as an admin for FertiliTalk.
So now, are the bulk of your services, is it just meetings where women are talking amongst themselves, or are there actual programs that you do, or do you invite experts?
A little of both. So we are, on Facebook, but every month, it's monthly now, we do live events where we meet up, and it can range from meet me for frozen yogurt event, a painting event. We have our biggest yoga on the beach event coming up. So every event has a little twist. Sometimes we do invite a doctor. Sometimes partners are invited, so.
So you mentioned yoga, and that's one of the things. There are a number of things that I noticed on the, there's a whole section on the RMANJ.com that is about collaborative wellness, and some of the programs are this East meets West sort of approach, and yoga being one of the things that's offered. Why do you think yoga is helpful in the fertility process?
Well, yoga in general has been shown to reduce stress. So if we just keep using that word stress, anything that will help us manage the stress that we're dealing with is going to be helpful for how you go through your treatment, for physically and how you feel about your treatment. And honestly, how you feel about things is really going to change your mindset. It's going to make you feel better and have you really be able to tolerate the ups and the downs. As everyone knows, this is not an easy journey at all for anybody. So I think yoga is one of those things that has definitely been shown to increase blood flow and makes the people feel physically better. It can help them with their, reset their mindset. Sometimes for everybody it's a little bit different. I personally did yoga during my own journey, so I can know how it made me feel, but I don't know if that's exactly how it would make someone else feel. But I think that the yoga classes that we do offer are not only something as a getaway from the intense medical aspect of it, but also these are fertility yoga sessions. So everyone in the room is going through their own level of what's going on. It's a bit like the FertiliTalk. Everyone there has that same thing in common. And one thing that can really happen when you're going through infertility is you tend to feel a little more isolated. So anything that we can do that can help people feel less isolated was really a benefit.
I mean, there's no guarantee. I mean, a lot of the things, and we're going to go through a lot of the different aspects of the collaborative wellness, none of them are guarantees, but they help. Then some people might find them more helpful than other people, but they do, in general, help address some of the overarching themes of stress and concern that might be weighing on a patient.
Absolutely. And really, when someone can feel a little bit more relaxed, a little bit more comfortable about where they are in their wherever they are in their journey. I've had some patients who've just wanted to continue yoga so much, they're pregnant, they're like, I don't want to stop this. This is great. And they'll continue it. They'll find a prenatal yoga person or they'll move on. But anything that can help decrease the stress, make you feel a little bit better, maybe connect you to a community, feel a little bit more comfortable with an uncomfortable place that you're in at that time is only going to be a benefit for the outcome.
How about acupuncture? Because that's another thing that's offered as well. Is this specific to fertility?
Well, I'm a big fan of acupuncture, and I talk about acupuncture to almost all of my patients. There's a lot of information, there's a lot of scientific research about acupuncture. We do know from data that acupuncture can help people with specific fertility issues. But overall, when people say to me, well, how does acupuncture help? I'm like, I'm not necessarily sure I know exactly how acupuncture helps. We know it can increase blood flow. We know it can make people feel better under certain circumstances in certain ways. But most women will actually feel more relaxed. Once again, that stress word comes up. Acupuncture can really help you sort of manage the situation. And I think managing what's going on with whatever modality you're doing, anything extra will help.
Are these the types of things that you talk about when you get together as a group? I mean, are you looking at where someone says, I tried this and I found it to be very relaxing, or I found this to really help me center?
Yeah, 100%. I mean, everybody tunes in their own opinions and what helped, what may have helped. Sometimes it's great because you hear so many ideas. But yeah, these are keywords that we do here.
And it must be nice to be in this sort of no judgment zone, right? Because everyone is in this place. You all know how fragile you might be feeling. And so there's a respect that goes with that.
Completely. Yeah, just a safe place where people can truly say, like, I get it, I understand.
So as a doctor, and these are a patient-driven group, but do you find that is helpful for your patients to have this outlet that they can go to outside of RMANJ?
Oh, absolutely. I think anytime you can have an outlet and an additional set of support, it's helpful. Some people only want to stick within their family or their one or two friends. Other people don't feel comfortable sticking with just their family or their one or two friends. So having these additional outlets like FertiliTalk is a very unique, fantastic situation. It's run by patients. It's for patients. Doctors are hands-off. And even though RMA is backing it and supporting it, we really want the patients to feel like it's theirs. It's their opportunity and it's their chance. So some patients, have a difficult time reaching out, finding that support, and this is a built-in way to just easily get that extra support. And we really do encourage it. I think the more you feel supported, it can only help as you're going through the process.
Another part of the collaborative wellness is counseling. Would this type of support group of peers take the place of professional counseling, or do you think those things go hand in hand?
I think they go together. I don't think one replaces the other for everybody. I think there are some people who feel more comfortable in an environment like FertiliTalk, where there is no technical professional that's there, but it is just a group of people who are all in that same journey. I think other people really would like a group or an individual session that's run by a professional. And I think for everybody finds their own. I think there are lots of people that probably overlap in that too. Anytime you can get that extra support. And the really nice thing, and I explain this to my patients, is that the counselors that we have at RMANJ, they are specific for infertility. So when you walk in the door, they know all of the words. They know IVF and oocytes and fertilization rates. And you're talking about, an egg retrieval or an insemination or a Clomid cycle or whatever it is, egg donation, sperm donor, they're already there. So you walk through and they're right on your page already. And that can make a very big difference. You don't need to sort of take a step back and explain your journey. You're kind of like, okay, here I am, and they're right there with you.
So is this something that you say to a patient? Let's say I'm sitting across the desk from you. Do you tell me, as the patient, we have these services where you can talk to a professional. We also recommend you might want to check out this FertiliTalk where you can talk to other women who are in this situation.
I actually like to bring up everything because honestly, even though I can get a vibe from a patient for that time that I've talked, I have no idea what really is going to work for them. And sometimes someone will say, you know what, I don't want to speak with anybody, I'm doing okay. And a week or two or a month goes by and they'll kind of say, all right, just give me a call if you want anything else. There are a bunch of options available. So they'll go to the website, they'll see FertiliTalk. I think the most important thing is that they know that it's available and people can just pick and choose what works for them, what timing works for them, when they want to engage. Maybe they don't at all. Everyone is different. I think that's sort of really where a lot of this came out of.
No, I think the combination, often I'll get an email, from a counselor, we're hosting our Tuesday group, can you post? And then people will chime in, oh, I'm going, are you going? And it's the best of both, in my opinion.
And do these counselors ever, the professional counselors, do they come and speak to the group, or do you have any sort of interaction with them?
Occasionally, but they do post often when they will be having their, meetings and things like that.
What do you find that the group benefits the most from? Is it each other's advice? Is it each other's understanding, the listening, or the talking? What?
It's just the entire, I can't say it enough, just the for patients by patients. It's what I love the most are patients that have graduated, have been there, and then they chime in just to say, I get it. They're still on board. They're still there to help. It's familiar faces that come back just because they want to give back, and that speaks volumes.
So in addition to the monthly meetings, the monthly events that you have, is this just where I might go to your Facebook page and post something about what I'm experiencing, and other women will just chime in and say, we're with you, or, I found this to be very helpful?
Yeah, and it ranges. I mean, if you're on the fence of starting a fertility journey, if you are deep in, if you want to return back, it's all different levels.
So another thing that we talked about, the acupuncture and yoga and the effects that they might have and the way that those can help. But one thing that has been proven to be very helpful in a lot of scenarios is diet and nutrition. Tell me a little bit about the role that plays in your whole overall collaborative wellness picture.
Well, nutrition's a very big part of the fertility journey. And in the earlier years of IVF and the assisted reproductive technology, we sort of didn't really look into that as much as we have in the past. So the last 5 to 8 years, there's been more and more good clinical research talks that have talked about having a good, healthy diet, a good BMI, being in a good, healthy state for your body and weight that really will improve your pregnancy outcomes. So we actually do have several nutritionists that work as part of our collaborative wellness center. And we do encourage all of our patients to even meet with a nutritionist, whether it's an issue of gaining weight, losing weight, maintaining. There are certain actual diagnoses that will work better with different diets that people don't realize. So it's a way to access those.
So it's very specialized then in that sense, because the specific issue that I might be having with fertility might be addressed by one diet, whereas somebody else's issue might be addressed by some other changes.
Absolutely. It's definitely not a one-size-fits-all. The nutritionists are fantastic with really listening to patients. I've had some patients who have been kind of reluctant to see a nutritionist and went and saw that, wow, that was a great experience. You know, they set very reasonable, realistic goals, whether it's a weight loss issue, whether it's an issue about a specific diet for a specific diagnosis. I find that they're very realistic, because the reality is that people are still under this stress. So you don't want to add an additional stress. And I try to explain it to people that we're not sending you to the nutritionist to make it harder for you. So now all of a sudden you've got to lose weight or you've got to change this or that. But our nutritionists really understand that. They work with the infertility population all the time. So they know that it is not about drastic this or that. It's about making small changes that can fit into lifestyle that can help make benefits.
But these things they're not magic bullets, but they do take some time. So in that case, if there is something that you would like to see a patient, you strongly recommend that a patient adapt their diet or their lifestyle. Would you tell them, let's wait a few months then before we start the actual treatment process?
It really depends on the patient. It depends on the patient's age. It depends on the patient's when they're coming in, what's their status. You know, it may be somebody, yes, that you say, wow, you know what, things are looking really good and weight may be an issue. Maybe we do take a few months to lower your weight, decrease your BMI, body mass index, before we move into treatment. And other people, you don't have that time, and you're being realistic about the big picture. And I think that's probably the whole point about all of this, is it's just about the big picture, not about the specific testing or the specific, stress, or what, patients hear all the time, just relax, go on a vacation. It's not about those kinds of things. It's about getting every last piece of the puzzle together.
So when it comes to nutrition and diet, I think people turn to the internet a lot in terms of looking for recipes and looking for suggestions. So is that something that you all have talked about as well? You know,
I'm just thinking of what Dr. Morris is saying, and you can tune on to a thread of FertiliTalk, and it'll say, oh man, can't I just have like a little, I'm depriving myself of one little, bagel donut, and then it's, also here's an awesome recipe that I shared from RMA, weekly. They share wonderful elimination diet recipes, certain things that I can, share as well. So it's a culmination of all of that.
Yeah, our Facebook page, the Collaborative Wellness Group does, and along with the nutritionist, put out a recipe once a week, and they're actually really good. And I'm not just saying that, I've actually made a bunch of them, and they're healthy, they're good for you. I mean, they're not sort of over the top where some people get a little bit, worried, I can't find that ingredient except in like one health food store somewhere. But they're great recipes, and it's nice to actually see it. I mean, I get them on my Facebook feed too, so there have been times where I'm like, oh, I'll make that. And it's nice to have that kind of outreach, because you see it's different. It's like, oh my gosh, the fertility clinic is sending me a recipe. Like, yeah, because that's all part of it.
So you've been around for 3 years, FertiliTalk.
Correct.
What has the response been like? What have you seen over those 3 years?
So over the 3 years, just increase of just support and support and support. Like I said, what's great is it's patients that have been there, they're still on it, and they're still helping other ones. So we've grown. We've grown in terms of events. We've grown in terms of support. We've grown in terms of just completely being there for one another.
But given that this is a global issue, but you are New Jersey based, this is a global issue, are you only seeing New Jersey?
No, we've expanded. Okay. I mean, there is somebody from treatment, out of country that comes, and everyone chimes in and helps them. So
even though RMANJ helped to start this process and help support it, it is really beyond the borders.
100%. And you do not have to be a patient at RMA in order to join FertiliTalk. So that just opens up a whole, different group.
Tell me a little bit about when the women first walk in, what do you find their attitudes are like versus after maybe a couple of your events?
So, yeah, I mean, like any kind of icebreaker opening, it depends on the event. But there were events, I usually try to do some kind of icebreaker. For example, we had an event at a place called Hummingbird. So I did different songs, and we had to hum the tunes, of like motivational songs. And, certain women will sit there, and then by the end, everyone's humming and singing and talking. And really, it just warms up as the day goes on.
It builds that community.
It builds it.
And the same thing for you then with your patients. Are you finding that because they are accessing this type of community that they keep in touch and they share their successes with each other, they share their sorrows with each other, it gives them a place to go?
Absolutely. It's the extra bit of that is, and one thing I think that they also forget to talk about is some, patients who've gone through the journey, so many of them want to help someone else. Mm-hmm. They know what it's like having been there. And so being able to go back into FertiliTalk and being there to be able to support someone, it's a little bit of a give back afterward, and that makes people feel so good, and it helps people who are in the journey. Being able to see someone was there, they were where I was 2 years ago, and now look at them. It's really very helpful.
I would think that there might be, for some people, an initial impulse of, like you mentioned, it can be very isolating, and they might feel like this is a little raw and a little personal, and I don't necessarily want to share it with others. Whereas there are other people who put it right out there on Instagram and on Facebook, and they welcome the conversation. Is either approach better than the other, or is it just really what you feel comfortable sharing?
It really has to be coming from the person inside, and there are definitely people who will, shout it out to the world. I'm going through IVF. This is my, second round of insemination. And for them, that's very helpful to let people around them know. For that person, that's great. For other people, they haven't even told their parents or their best friend. And, it's not necessarily that self-isolation. This is what they're comfortable with. Sometimes those patients who don't want to talk to their family find something like FertiliTalk fantastic because it really is a community that's set up ready for them that they don't have to worry about judgment. Other people, even if they're out there talking about it, still working with a community. So I think it just depends on the individual person, and there's no one recipe. There's, just like we tell patients, you can't compare your treatment to someone else's. There's no one recipe that's going to get everybody pregnant. She did this, I should do that. It's the same thing with support and with wellness and the collaborative wellness. There's no one thing that's going to
I did hope my thoughts were all over. At times I was very quiet about it in the beginning. And then, I did read somewhere, and it sticks in my mind a lot, a quote, because I know these cliches, and I'm not going to give one that doesn't mean a lot. And I'll even hold up my FertiliTalk mug to this one, that it went like this. It said, don't be ashamed of your story. It can inspire someone. And I think that's what it's about. It's saying, and it's okay to be, there's no right or wrongs, but knowing that you can help somebody or inspire them or just make a difference, I think, right now is where I'm at. And
I think the bottom line of all this is to really tap into whatever makes you feel better, whatever helps you. And we were talking before we began, you have a specific necklace that you wear. My sister, when she was going through this process, had a mantra that would occasionally appear like an alert on her phone and just remind her to stay centered and be positive. These little reminders that you can leave for yourself, jewelry or a note, it helps along the way.
I think it does, and I think even for anybody, anytime where they are. But it just what works for me might not work for you. So my mantra, and people will say, "Oh, just do this or that." Well, my mantra, work now might not sing or speak to someone else, but somebody else may come up with something. But they do. There's a lot of information about meditation and mantras that it really do help focus and center people. So I think that that's a great opportunity, and I just feel that you don't want to box people in. Let them choose what their mantra is. Go out there, figure out what actually speaks to them, and then if it works, it works. If it not, maybe try something else.
Meditation is another thing that's offered through?
We are working on meditation, and meditation is also a very individual process. I've actually just started working on myself with that. Have you done that yet?
My own little lie.
It's interesting. It's not easy.
No, it takes a lot of patience.
Yeah, it does. It takes a lot of patience and a certain amount of time. And I keep doing these 3-minute meditations, and so they work at different times for different people for different things. But I think once again, it's all about feeling, self-motivated, self-centered, feeling that you're feeling good kind of from the inside so you can handle what else is going on.
Right, like one of the posts, just for an example, on National Infertility Awareness Week, I'll raffle off, let's say, a $50 spa gift card, and I'll say, what do you do to make yourself feel good? Are you rocking out in the morning to your favorite song? Are you treating yourself to a pedicure? What are you going to do, to make yourself just feel good?
All right, ladies, thank you so much. I'm very inspired by this conversation. I'm sure a lot of folks watching it are feeling very positive and pumped up and eager to find out more information. So, of course, you can do that by going to RMANJ.com. There is a specific drop-down menu where you can find everything that you need to know about collaborative wellness and the programs that are offered here. And Annika, if you could tell us about your Facebook page.
Sure. If you visit, it is a private group called FertiliTalk. On the way here, I accepted over 1,250 members, so hoping we keep that going.
So would someone go there and request that they have access?
Correct, you request, and someone has to be approved to join it.
Okay, so even if I don't know anyone who's already in it, having seen this Facebook Live segment, I can go there and submit some...
100%. Just look up FertiliTalk. It's the only one out there. Click request and,
And that's where you'd find out any information about the public meetups about...
Correct, yes. All that's posted.
All right, so there you go. Facebook.com for FertiliTalk and also RMANJ.com. Look for their collaborative wellness segment on the drop-down menu. So thank you so much for spending another Wednesday with us. We will be back next Wednesday at noon with another Facebook Live segment. Thanks, ladies.
Thank you.
Thank you.